Good morning, Mrs. Bickford. I'm Nurse Cassie.
Hi, Nurse Cassie.
We had talked this morning about going over your discharge paperwork. So I'd like to go over a couple of things about your new medication with you now. So you're now prescribed lithium, which I know you're aware of, and we're going to talk a little bit about how to safely take it and things you should know. Lithium is a mood stabilizer, so it can help even out your highs and your lows. It can also help with that feeling of severe depression that you were experiencing just before you came in here. It's important that you take it every day as prescribed. Your provider wants you to take it once a day before bedtime. Also important to know that you need to drink plenty of water when you're having your lithium. This is because lithium will make you pee more, and when you're peeing more, you can lose some fluids and get dehydrated. So we want to make sure that you're drinking plenty of fluids, a little extra than what you're used to if possible. We also want to make sure that you're not limiting your salt intake. When you're going pee so often, you can get rid of some of your body's salts. So you want to make sure that you keep a good balance. So this does not mean loading up your plate with salt or increasing and having a lot of salty things, but it does mean not purposely avoiding salts or limiting them. It's also very important that you take the medication every day and for best effects about the same time every day. What I suggest is using your smartphone and setting an alarm. So if you go under clocks, you can set an alarm. You can give it a name. It doesn't have to identify that it's for your medications, just something that you will know. And you can set it for every day of the week first time. This will act as a backup in case you're having a busy day or one of those days where you're just not feeling yourself, and it'll give you a second boost, a little extra plan B to make sure you take your medications. And then I also wanted you to take a look at the bottle here. And I wanted you to tell me, what is the dosage that you're
900
taking?
milligrams.
Right. And so how many tablets would you need to
It'd be
take?
3 tablets.
Correct. Very good. And do you see on the label where it says, after the medication name, it says ER? That's extended release. And that means that the medication is delivering little bits to you over a long period of time. So it's very important not to chew or crush. I'd like to ask you a few questions if you're okay with that. So you've already told me what dose you're taking and how many tablets, so that's great. Can you tell me, because it's an extended release, those two little letters we just talked about, it means that it's giving you medication slowly over a long period of time. Can you tell me what you should not do?
Don't chew or crush.
Yes, that's correct. And can you tell me why you want to drink a lot of extra water while you're on this medication?
Yeah, I'm gonna drink a lot because I am going to be peeing a lot and you don't want me to get dehydrated.
Yes, absolutely. Yes, you're going to be peeing a lot more. It'll get to a level where you get used to it, but the first few days might seem a little intense. You may have already experienced that when you were here in the hospital. And can you tell me the importance of checking your lab work?
I need to get my blood drawn to make sure that my lab value's checked. We don't want it to get too high, so that can be dangerous, but we want it to be enough that it's going to help me.
Yes, that's right. Perfect. So it'll just take a little bit for me to get the rest of your discharge paper ready. I'm going to print everything out for you. I'm going to have you sign it, and you can ask any questions. Do you have any questions for me at the moment? Okay, great. See you in a little while.